Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wondered how the big curveball of the COVID-19 pandemic actually messed with our heads and our bodies across different ages? Well, this new study dives deep into that, looking at how our physical health, mental health, and even our daily habits got tangled up during those strange times. They're not just looking at one thing, but how everything connects, like a big web. So, what was the big question here? Imagine the pandemic as a giant storm. This research wanted to see how different people of different ages weathered that storm. Not just individually, but how their health pieces, physical, mental, and lifestyle influenced each other. Within that storm, they wanted to understand which factors were super important for certain age groups, and which ones were important for everyone. The COVID-19 pandemic was a massive global event, right? Think about all the lockdowns, the isolation, the sheer stress. It definitely hit our health hard. We heard a lot about people getting sick, sure, but also about growing anxiety and depression. And our daily habits changed too, maybe more screen time, different sleep patterns, or even changes in what we were eating or drinking. But what's really interesting is that these things don't happen in isolation. Your mental health can affect your physical health and your lifestyle can impact both. That's where this study gets cool. So how did they actually do this big study? First, they gathered a ton of data from people across the Netherlands, spanning a huge age range from teenagers all the way up to older adults. They specifically looked at how much the pandemic negatively affected people. They sorted people into two main groups, those who felt the pandemic had a low impact on their lives, and those who felt it had a high impact. It's like sorting people into those who just got a bit rained on and those who were caught in a downpour. Then they looked at what kinds of people were in each group. The really special part of this study is how they looked at the connections. Instead of just saying this factor is bad, they used something called network analysis. Think of it like drawing a map of how different health factors are connected. Each health factor is a dot, and the lines between them show how they influence each other. Stronger lines mean a stronger connection. They built these network maps for each age group, and then for both the low impact and high impact groups within each age bracket. This lets them see the whole picture of how everything was linked. After building all these maps, they compared them. Which connections were the same across all groups? Which ones were unique to teenagers versus older adults? And how did the pandemic's impact change those connections? This is where they really start to understand the nuances. So, what did they find? One of the biggest, most consistent findings across all age groups was that if people experienced financial difficulties during the pandemic, they were much more likely to feel the whole thing had a high negative impact on their lives. This makes a lot of sense. When money gets tight, especially during a stressful global event, it can really amplify anxiety and make everything else feel worse. Now, let's talk about those network maps across every single age group, whether they were young or old, high impact or low impact. One thing stood out: perceived general health. This is basically your own feeling about how healthy you are. It was like the superstar node in all their maps. It had really strong connections to both mental health and how much people were physically active. So, if you felt your general health was good, you also tended to have better mental health and be more active, and vice versa, especially during the pandemic. But it wasn't all the same for everyone. The study found that while perceived general health was central everywhere, each group also had its own particular key players. For example, for young people, things like substance use and mental health status were really important in their network, especially if they were in the high-impact group. For older adults, factors related to COVID-19 infection itself, like having long COVID, were more prominent in their health networks. This tells us that while the pandemic affected everyone, it did so in specific ways depending on your age and how much it really shook your life. What does all this mean for us in the real world? The researchers emphasize that this kind of detailed understanding is crucial for policymakers. Knowing that financial difficulties are a major trigger for feeling overwhelmed by a crisis means we need to focus on socio-economic support. It's not just about health advice, it's about addressing the bedrock issues that make people vulnerable. And because different age groups have different key health factors, interventions need to be tailored. You can't use the same strategy for a teenager and a 70-year-old dealing with a public health crisis. This research provides a roadmap for making sure that when the next crisis hits, our support systems are smarter, more targeted, and more effective for everyone, especially for those who are most vulnerable. Let's briefly touch on how they did it. They used data from 3 large surveys conducted in the Netherlands. Think of them as big questionnaires that ask thousands of people about their health, their lifestyle, their jobs, their families, and how the pandemic affected them. They use really large sample sizes, which is great for getting reliable results across different groups. To figure out who was high impact versus low impact, they looked at things like how much the pandemic affected people's daily lives, if they had suicidal thoughts, experienced trauma, or had to delay medical care. They used these factors to categorize people. The actual number crunching involves some sophisticated statistical techniques. They used what's called chi-square tests to see if the groups of people with high versus low impact were different in terms of their background. But the real star was the network analysis, using something called mixed graphical models. This is what allowed them to visualize and quantify those connections between all those different health variables. They also used network comparison tests to see if the connections in one group were significantly different from another. One of the really interesting parts of the results was comparing the adult and elderly groups specifically. Even within these broader categories, they found that the networks of connections between health factors differed. For example, in the low-impact elderly group, the connections between COVID infection and long COVID were stronger. This suggests that even for those not severely impacted, the threat and lingering effect of the virus had a distinct way of weaving into their overall health experience. So, diving a bit deeper into the results. Remember how I said financial difficulties were a big deal? The study showed small to medium effect sizes for this across all groups, meaning it wasn't just a tiny difference, but a noticeable one. This is a really important takeaway for social policy. For youth, they saw that perceived general health was strongly linked to happiness and their overall mental health status. But interestingly, in the high-impact youth group, the connection between happiness and mental health status was even stronger. This suggests that when things get tough, those happy moments become even more critical for maintaining overall mental well-being. Also, substance use like tobacco and cannabis was closely linked for them. For young adults, perceived general health was also tied to mental health status and physical activity. What was unique here was the connection between mental health status and stress. In the high-impact group, this link between feeling stressed and their overall mental health status became stronger, hinting that the pandemic really amplified the negative impact of stress for this group. In the adult and elderly groups, perceived general health was strongly connected to lower levels of anxiety and depression and higher amounts of physical activity. This is quite intuitive, but what's striking is that in the high-impact groups for adults and elderly, the connections between the COVID infection variables recent infection over 3 months ago, and long COVID became much stronger. This shows that for older individuals, the direct experience and aftermath of the virus had a particularly profound and interconnected impact on their health systems. The researchers ran accuracy checks on their network models, which basically means they tested how stable and reliable their findings were. The good news is that the main connections they identified seemed to be quite stable, meaning these patterns weren't just a fluke. When comparing across different age groups, they confirmed that perceived general health was always a central player. But the other key players shifted. Substance use was more central in younger groups, mental health for youth, and COVID-related issues for adults and the elderly. This really drives home the idea of different life stages having different vulnerability points during a major stressor like a pandemic. The strength of the connections between anxiety and depression and overall mental health status was also stronger in both adult low and high impact groups, emphasizing the persistent link between mood and general mental functioning in adulthood. They also did some extra checks called sensitivity analyses to make sure their results weren't just due to missing data. The findings held up, which gives us more confidence in what they discovered. Now, let's really dig into what this means. The study confirmed that financial difficulties were a major driver of how negatively people experience the pandemic. This aligns with a lot of other research showing how economic instability breeds stress and poor health. The central role of perceived general health is a huge finding. It acts as a kind of umbrella, covering aspects of both physical and mental well-being. When people feel generally healthy, it is a positive sign for many other areas of their lives. The fact that it was so central in all these different networks, even during a crisis, highlights its fundamental importance. Scroll practical implications. The practical implications are pretty significant. Firstly, addressing financial disparities is key. This means policies that support economic stability can prevent a lot of health problems, especially in times of crisis. Secondly, focusing on improving people's general sense of well-being, both before and during a crisis, could be a powerful preventative strategy. It's about building a strong foundation. This point is really about social justice and preparedness. If we know that money worries make the impact of crises so much worse, then policies that reduce those worries are also health policies. This emphasizes building resilience. If feeling generally healthy buffers against negative impacts, then programs that promote overall well-being, mental, physical, social become even more important, not just as nice-to-haves, but as essential public health tools during crises. This is the call for tailored approaches. We can't have a one-size-fits-all solution. Understanding the specific health connections and vulnerabilities of different age groups is crucial for designing effective interventions. Now, every study has its strengths and weaknesses. A big strength here is the use of network analysis, which gives a much richer picture than looking at factors in isolation. The cross-generational perspective is also fantastic. However, like many studies, this relied on self-reported measures. People might not always remember things perfectly, or might answer in a way they think is expected. Also, the data was collected at different times for different age groups, which could introduce some differences. And importantly, because it's a cross-sectional study, they can't definitively say that one thing causes another. They can only see how things are connected at a certain point in time. So, to wrap up, this study gave us a really detailed look at how our health is all interconnected, especially under the stress of a pandemic. They showed that financial worries were a major factor in how badly people were affected. Perceived general health was like the central hub in everyone's health network, linking physical and mental well-being, and importantly, different age groups had unique patterns of vulnerability and resilience. This research is a great example of how understanding these complex connections can lead to more effective public health strategies. By recognizing that financial stress, perceived health, and even specific factors like COVID infections play different roles in different age groups, we can better prepare for the future. It is a reminder that health isn't just about individual factors, but about the entire system they exist within. Future research could look at these networks over time using longitudinal data to really pinpoint cause and effect, and perhaps explore interventions tailored to these specific network structures. What are your thoughts on how the pandemic impacted your own health network? Did you find certain factors became more important for you? Let me know in the comments below. If you found this breakdown helpful, please give it a like and subscribe to RUBIN'S Mind Lab for more dives into the fascinating world of psychology research. See you next time.